Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The Numeric rating scale assesses pain intensity in patients with acute or chronic conditions. It requires patients to rate their pain on a scale from 0, indicating no pain, to 10, representing the worst possible pain. This tool is widely used in clinical settings to quantify subjective pain sensations objectively. Its main purpose is to facilitate pain management by guiding treatment decisions and monitoring therapeutic outcomes in conditions such as musculoskeletal disorders, neuropathic pain, and post-operative pain. The scale offers a simple, reliable, and valid method for assessing pain severity across diverse patient populations. The Numeric rating scale is indicated for adult patients capable of self-reporting pain intensity. It is widely used in populations with acute and chronic pain, including post-operative patients, individuals with musculoskeletal disorders, and those experiencing cancer-related pain. The scale is most useful in clinical contexts, requiring rapid, simple, and reliable pain assessment. It facilitates monitoring changes in pain over time and evaluating treatment efficacy. The scale demonstrates high validity and reliability across diverse patient groups, provided cognitive and communicative abilities are intact. The Numeric rating scale consists of a single item measuring pain intensity. The patient is asked to rate their pain on a scale from 0 to 10, where 0 represents no pain and 10 signifies the worst possible pain. The question is typically phrased as, on a scale of 0 to 10, how would you rate your pain right now? Responses are recorded as an integer within this range. The clinician presents the scale verbally or visually, ensuring that the patient understands the endpoints and the meaning of the numbers. Scores from 0 to 3 indicate mild pain, 4 to 6 denote moderate pain, and 7 to 10 reflect severe pain. This categorization aids in evaluating pain severity and guiding treatment decisions. The scale's simplicity allows for quick administration and repeated measurements over time. The sensitivity of the Numeric rating scale for pain assessment reflects its ability to correctly identify patients experiencing clinically significant pain. Studies have reported sensitivity values ranging from 0.75 to 0.9 in various populations, indicating that the scale can correctly detect pain presence in 75 to 90% of cases. Specificity measures the instrument's capacity to correctly identify individuals without significant pain. Reported specificity values for the Numeric rating scale range from 0.6 to 0.8, meaning it accurately identifies non-pain cases in 60 to 80% of instances. For example, in post-operative patients, a sensitivity of 0.8 indicates that 80% of those with meaningful pain intensity are correctly classified using the scale, while a specificity of 0.7 reflects that 70% of patients without significant pain are accurately excluded. Sensitivity and specificity are critical for understanding test performance. High sensitivity minimizes false negatives, and high specificity reduces false positives, ensuring appropriate clinical decision-making. The Numeric rating scale was first introduced in the mid-20th century as a simple yet effective tool for assessing pain intensity. Its validation has been extensively documented across diverse patient populations and clinical settings. Jensen and colleagues in 1986 demonstrated strong convergent validity between the Numeric rating scale and other established pain measurement instruments such as the visual analog scale and the verbal descriptor scale. Subsequent studies have consistently reported high test-retest reliability, with correlation coefficients typically exceeding 0.9, indicating stability over time. Research by Williamson and colleagues further confirmed the scale's responsiveness, noting its sensitivity to clinically meaningful changes in pain levels during treatment. Evidence also supports its capacity for use in both acute and chronic pain conditions, with psychometric properties remaining robust across age groups and cultural backgrounds. The simplicity of the numeric rating scale facilitates ease of administration and scoring, contributing to its widespread adoption in both research and clinical practice. Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.